Hello, I'm Dr. Tom DeWitt. I'm the Director of the Division of General and Community Pediatrics. The missions of the Division of Clinical Care, Education, and Research are accomplished through 6 sections within the division, which consist of inpatient care, primary care, special needs, community pediatrics, education, and research. The clinical mission of the division is primarily provided for by the sections of inpatient, outpatient, and special needs. The inpatient section consists of a hospitalist group, which provides services both here at the base, but also at one of our satellite outpatient and inpatient units at Liberty Township, northwest of Cincinnati. These 2 services provide care to over 4,500 admissions a year, accounting for about a fifth of all the admissions at Cincinnati Children's Hospital. The outpatient group provides services in multiple sites throughout the greater Cincinnati area, and that's about 75,000 visits a year that are seen by our group, and that's seen both here at the base, at a urban clinic on the west side of Cincinnati, at a private practice in Batesville, at several school-based clinics throughout Cincinnati, and also through services we provide to one of the largest federally qualified health centers here in Cincinnati. The Special Needs Clinic and Center provides care for multiple complex patients, some of the most complex and difficult patients that are cared for here at Cincinnati Children's. The educational mission of the division is probably one of our biggest areas that we deal with regard to the rest of the institution. We provide virtually all the teaching of the medical students from the University of Cincinnati College of Medicine, both in first-year seminars, but primarily through their third-year clerkship, which is done entirely in and under the auspices of the Division of General and Community Pediatrics. We also have a fellowship program that trains fellows in health services, research, quality improvement, and medical education. And probably one of the most striking things that we do is our faculty development program, which not only trains fellows and young faculty with regard to rigorous approaches to education and training, but also has an online Master's in Medical Education that we do in collaboration with the College of Education at the University of Cincinnati. And this program actually is unique not only nationally, but probably internationally. The research mission of the division is provided not only by some of the clinical area, particularly with regard to their quality improvement projects, but also by the research section that has 3 main areas of foci. Those foci include a nutrition, bone health, and physical activity group, and they focus their area to a great degree on obesity, looking not only at ways of preventing obesity, but also setting new tones and tenors in child care settings with regard to nutrition and physical activity in those kinds of settings. The other area that the research group focuses on is environmental health, particularly prenatal exposures to such things as tobacco, smoke, and lead, and looking at the impact that these exposures have after delivery and in young childhood with regard to such conditions as attention deficit disorder and asthma. The final area that the research group focuses on is chronic disease, and this again looks at much at patient care delivery and quality improvement projects in that area, and particularly focusing on asthma as the major chronic illness that we deal with. In summary, I think the important mission for our division is using these 3 areas of clinical care, education, and research to improve the outcome, to change the outcome for the important population that we serve, which for us is a large underserved population, not only here in Cincinnati, but in the region, nationally, and actually internationally.